Why do you want to work as a caretaker?
I have always enjoyed helping people, especially those who are vulnerable or in need of assistance. I find it rewarding to provide care and make a positive impact on someone's life. Being a caretaker allows me to apply my skills in compassion, patience, and problem solving to support others in their daily lives.
What qualities do you think are most important for a caretaker?
The most important qualities are compassion, patience, and attention to detail. Compassion helps me connect with the person I'm caring for. Patience is crucial when dealing with challenging situations, and attention to detail ensures that I can follow medical or personal care instructions precisely.
Can you give an example of a time when you handled a difficult situation with a patient or client?
In my previous job, I cared for an elderly gentleman with dementia who sometimes became agitated. One day, he was upset because he couldn't remember where he was. I calmly reassured him by introducing myself again and explaining where he was. I used gentle communication and kept things consistent, which helped ease his anxiety.
How do you handle stressful situations while taking care of someone?
In stressful situations, I take a moment to stay calm and assess the situation. It's important to focus on the immediate needs of the person I'm caring for. For example, if someone is in pain or uncomfortable, I address that first, using any instructions provided by their healthcare team. If needed, I communicate with supervisors or family members to ensure the person gets the right care.
How do you ensure the privacy and dignity of those you are caring for?
Maintaining privacy and dignity is one of my top priorities. I always knock before entering a room, explain what I'm going to do before starting any tasks, and ensure that they are covered or clothed as much as possible when providing personal care. I also make sure to listen to their preferences and respect their independence as much as possible.
How do you handle medical emergencies?
In case of a medical emergency, I stay calm and follow the emergency protocol. I check the person's condition and provide first aid if necessary. I call emergency services immediately and provide them with accurate information about the situation. I also make sure to inform the family and my supervisors.
How do you manage your time when caring for multiple clients or tasks?
I prioritize tasks based on urgency and the needs of the individuals. I keep a schedule to ensure that I complete important tasks like administering medication or helping with meals on time. I also leave room in my schedule for unexpected situations, and I communicate with my team or supervisors if I need assistance to manage my workload.
What is your experience with individuals with special needs, such as Alzheimer's, dementia, or disabilities?
I have experience working with individuals with dementia, including Alzheimer's patients. I understand the importance of a structured environment and routine for them. I've been trained to handle challenging behaviors, such as confusion or aggression, with patience and empathy. I've also worked with individuals with physical disabilities, helping with mobility, transfers, and daily activities.
How do you communicate with someone who has difficulty understanding or speaking?
I use simple language and clear gestures to communicate. Sometimes I'll write things down or use pictures if necessary. I also give the person plenty of time to respond, avoiding any rush. If I'm caring for someone who uses a specific communication device, I make sure to learn how to use it properly.
What would you do if a client or patient refuses care?
If a client refuses care, I first try to understand why. Sometimes they may feel uncomfortable or scared, so I calmly explain why the care is necessary and how it can benefit them. I never force care. Instead, I try to build trust and find a compromise. If the refusal continues and is serious, I inform my supervisor or their healthcare team for further guidance.
How do you handle feedback from family members or supervisors?
I welcome feedback because it helps me improve my skills and provide better care. If a family member or supervisor offers suggestions, I listen carefully, ask questions for clarification, and apply their feedback. I'm always open to learning and growing in my role.